Here now is the founder and CEO of Envita Medical Centers, Dr. Dino Prato. Welcome to the show.
Thank you for having me.
Look, we're spending a lot of time talking about all of the things that RFK Jr. said he was going to do when he became Health and Human Services Secretary. I mean, I'm still shocked by some of the stuff I'm learning, like all of the additives and ingredients and things they put in food that they didn't have to put in food, and now they're banning the stuff they put in vaccines they didn't have to put in vaccines and banning. And if you look at children in America, they're obese, they're unhealthy. The president just passed that executive order to try to put together the program to kind of encourage physical fitness. Remember the back in the day with Arnold Schwarzenegger and people? I mean, what's your take about the state of healthcare in America, especially, or health of our youth in America, and what are you looking forward to with respect to the changes with MAHA?
Well, it's so exciting for families across America. We know chronic disease is the cause of so many problems, not just the expensive healthcare, but the suffering of families, whether it's cancer, diabetes, even some of the complications we see with chronic disease. And so here we're getting to the cause. We're looking at what are the chemical toxins. We're just getting started. I think this MAHA movement, which Kennedy did a great job getting it galvanized and moving it, is getting everybody excited about getting the chemicals out of the food, which we should have done a long time ago. But now we're starting to look at how do we get our kids healthy? How do we change the way we live so we can live a long and blessed life? And the way to do that is really starting with the food, getting nutrient-dense foods in the diet, getting these chemicals out, getting a lot of the sugars and additives, and helping our kids function better, right? I mean, so it's very exciting, and kudos to the current administration for the work they're doing.
Yeah, you know, this is, I think, a renewed focus on, and it's not even a partisan issue. I mean, everybody should want American children to be healthier. We should want our food to nourish our bodies, not destroy it. You know, we don't want healthcare to be sick care. We want to stay healthy and not need visits to the doctors. I mean, when you look at some of the things that are facing, whether it be the vaccines, whether it be the food, whether it be all of these things, where do you see this going? Do you feel like we're going to turn a corner here? Changing old habits is hard, right?
It's very hard. I mean, when you look at almost 86% of some of these issues are chronic disease driven. When we look at cancer, autoimmune, heart disease, very preventable, right? And especially with early screenings, but it starts right at childhood with the way we feed our kids. So we're on the right track, but I don't think this solves everything. This just opens the door for the right conversation because we still have a very large medical industrial complex. And to be honest, it profits on the system, right? And the system needs to change. We need to be, getting our physicians to talk more about diet, nutrition, lifestyle, which is starting to happen. It's starting to move. And also we need to look at what are the causes of these chronic diseases. So even when the patients get older, on our end, what we see in oncology all the time is these patients are, there's metabolic components to this disease, there's chemical toxic components, their immune system is downregulated. And if we can help people understand this at a young age, I do this with my children. I have 4 kids, and they just understand quality of food, nutrient density of food, getting the chemical. And so what that does is it prepares their mind and their life so that they don't get as sick and they have a better quality of life. So I think education drives a lot of this, and we're just in the beginning of that.
Yeah, I mean, look, that's what we want out of this whole MAHA movement, is to make people more aware of how to be healthy, not so much how to get health care, but just to be healthy.
That's right.
Dr. Prato, thank you so much for joining. If you want people to follow you, where can they go?
They can visit us at Envita.com, ENVITA.com, and we have lots of information and ability there to help people with chronic and terminal illnesses, particularly oncology. When they have failed care, we have technology to help them. So they're welcome to join us.
Well, thank you so much for joining tonight.
Thank you. Take care.